Hi, welcome to my channel. Today we will discuss high blood pressure, also called hypertension, what it is all about, the causes, the diagnosis, and professional medical advice on managing high blood pressure. First, we need to understand that the heart is the organ that pumps blood, which circulates in the body. What is blood pressure? It refers to the force that blood exerts on the walls of the arteries. That is the blood vessels as it flows through them. Ideally, a person's systolic pressure should be between 100 to 120 millimeters of mercury, and the diastolic 80 millimeters of mercury. A reading regularly at or above 140 for systolic and a reading at or over 90 for diastolic is called high blood pressure or hypertension. It is one of the most common medical conditions worldwide and rarely has noticeable symptoms. A high percentage of people with this medical condition don't know they have it. It is a silent killer. This is a problem because if left untreated, high blood pressure can lead to serious medical problems. Our blood pressure goes up and down throughout the day depending on how hard the heart is pumping, the overall blood volume, and the resistance in the blood vessels. For example, in active or stressful situations, the heart beats faster and the blood vessels narrow, temporarily raising blood pressure, causes of high blood pressure. So, how does the condition of hypertension develop? Healthy blood vessels are elastic, like a rubber band, that allows them to cope with changes in blood pressure. However, different risk factors reduce this elasticity and increase resistance in the blood vessels, leading to persistently high blood pressure. These risk factors include 1. Increasing age. As one age, the possibility of becoming hypertensive increases. 2. Poor diet. 3. Smoking. 4. Drinking too much alcohol. 5. Being overweight. 6. Physical inactivity. And 7. Family history. High blood pressure can also be related to, or directly caused by, other health conditions or certain medications. Dangerous effects of high blood pressure. As a silent killer, it doesn't usually cause symptoms on its own. However, regular high blood pressure strains the blood vessels and leads to tiny tears within the blood vessel walls. These tears increase the risk of fatty buildup, or clots, which can narrow or block the blood vessels. If this happens in the brain, it can lead to a stroke. In the heart, it can lead to a heart attack. It can affect the eyes and result to vision loss, and in the kidneys, it can lead to kidney disease. In this case, the heart works harder to pump blood around the body, which can lead to heart failure. Diagnosis of high blood pressure. Nurses and doctors measure blood pressure manually or electronically, using a cuff. As it is being inflated around the upper arm, readings can be taken either manually or electronically. Blood pressure fluctuates from time to time, therefore, several readings are needed from time to time to get a reliable measure. Electronic kits can be easily used at home for regular monitoring if high blood pressure is diagnosed. Your doctor or nurse practitioner may arrange for further visits to monitor for risk factors and signs of damage. Doctors may also recommend one or more medications to control blood pressure. Some work on the heart, reducing the speed and strength of the heartbeat. Others work on the kidney to lose more water, reducing blood volume. And many work directly or indirectly on the blood vessels themselves. Professional advice on the management of blood pressure. Many lifestyle changes can help maintain a healthy blood pressure. These include 1. Eating healthy foods with less processed and salty food and more fruit and vegetables. 2. Engaging in non-strenuous exercise to maintain a healthy weight. 3. Avoid smoking and reduce alcohol intake. 4. Each type of medication may have different side effects in some people. Speak to your doctor or nurse practitioner if you notice any side effect. 5. Always take your medication as prescribed. And 6. Monitor your blood pressure regularly to check if it is under control. High blood pressure is an important condition, but it can be controlled, and it is also largely preventable. Adopting healthy habits now will help prevent serious consequences later in life. Watch out for my next video on further teachings on natural ways to manage high blood pressure. Please hit the like button, subscribe to my channel, and turn on the notification bell. Thank you.